So I presented that data yesterday. It's a phase 1/2 study, TRANSCEND-CLL-004. It's for patients with relapsed or refractory CLL, and all patients needed to have failed at least 2 or 3 different lines of therapy to be eligible for this study. All patients needed to have failed at least one BTK inhibitor, and all of them ended up failing, progressing on ibrutinib. We enrolled 23 patients on the phase 1 portion of the study, and that's basically what I presented on. There was a subgroup of patients out of this 23 who had failed not just ibrutinib but also venetoclax, so more of a bad acting kind of a disease group, if you will. We found that these 23 patients tolerated the Liso-cel CAR T-cell infusion pretty well. There were only 2 patients out of the 23 who developed cytokine release syndrome at a grade 3. There were no grade 4s. 74% did have some CRS, so usually grade 1 or 2, manageable, just fevers, chills, that kind of thing. But 2 patients had grade 3, also manageable. As far as neurotoxicity is concerned, which is the other known sort of common side effect of CAR T cells, there were about 5 out of the 23 patients who developed grade 3 or 4 neurotoxicity. Overall, 39% patients had some grade neurotoxicity, so fairly well tolerated. We found at the 30-day assessment time point after CAR T cells that the best overall response was 81% with 45% complete remissions. In the subgroup of patients who had failed both ibrutinib and venetoclax previously, those patients also had a very good response at 89% overall response. We checked minimal residual disease at the day 30 mark and then subsequently as well in the blood and bone marrow, and we found that overall 65 to 75% patients had achieved undetectable minimal residual disease, and also in the double refractory subgroup they had achieved up to, I want to say, 70 to 80% undetectable MRD levels. So very high responses. The key question always is, how long do these responses last? Are they going to be durable? And so the data I showed, 10 of 12 patients who were in a response at 6 months maintained their response at 9 months, and now 8 are out a year or more and have remained in a CR or a PR. Everyone who had achieved undetectable MRD never lost that. They never became positive again. And there were about 3 patients who did develop Richter's transformation after becoming MRD undetectable for CLL, but by and large, for the rest of the whole group, the MRD undetectable folks are remaining in remission and doing extremely well over time. So we need to follow longer, but we'll see how it goes.